Chill morning delegates, we will never have this day again, so let's make it count. We welcome you all for the day 2 sessions of the 7th Lava TNCE program. The first session will be handled by Dr.A.Methai, Associate Professor and Head, Department of Clinics, Veterinary College, Theni, on the topic Management of Repeat Breeding Syndrome in Cattle. Dr.A.Methai completed B.V.Sc and M.V.Sc in Obstetrics and Gynecology from Madras Veterinary College and completed his Ph.D. from IVRI on the effect of buffalo oviduct proteins on freezability of bovine spermata. He worked at Veterinary College of Veterinary Sciences, Tirupati and Gannavaram for 4 years and worked as assistant professor for 14 years. Currently, he is working as associate professor and head, Department of Clinics, Veterinary College, Theni. He handled NADP and DBT projects and guided 2 M.V.Sc and published 35 scientific articles.
Good morning. Good morning, the Lava team, for the opportunity first. To start with the management of repeat breeding syndrome in cattle. If you all look into the dairy industry to optimize and achieve the reproductive efficiency, optimum reproductive efficiency, we have to maintain the certain reproductive goals in the cattle. The first is to start with the yesterday's sessions, like the management of the calf to have a better heifer or a best heifer to achieve the conception by 1.5 years to 2 years of age at least. Then the first calf around 2.5 to 3 years of age. Then a calf per year. The mantra which is in the dairy industry for more than 2-3 decades. We have to get a calf from 3 years of age onwards up to the reproductive life of the cattle, maybe around 8 to 10 years of age. Of about 6 to 8 calves are should be harvested from the cows on an average to have the optimum reproductive efficiency. To achieve this, we have to have the better calf management and heifer management, and we have to get the first calf at 2.5 to 3 years of age. Then the calving, after calving, we can give a rest of 2 months. Then we have to go for the inseminations. The number of inseminations required for the conception is around 1.8 to 2 as per the norms. And within 2 inseminations, we have to get conceived the animal by 3 months. Then if you add the gestational length, roughly 12 to 13 months of gap, we have to get a calf. So that the maximum reproductive efficiency of getting 6 to 8 calves and maximum lactation from a dairy cattle could be achieved. To achieve these reproductive goals, the main puzzle in front of the veterinarians is the repeat breeding syndrome. Okay, right. Repeat breeding syndrome, we recollect the definition. It is the cow calved once, having normal, near normal reproductive tract, reproductive estrus cycle length, estrus length, and bred at least 3 or more times with a fertile semen. With a fertile semen, it should not have the any palpable abnormalities in the reproductive tract, and the vaginal discharge should be apparently normal. So the animal will be looking apparently normal. However, it fails to conceive with our fertile inseminations or the fertile matings. Mainly, the causes of the repeat breeding syndrome is broadly classified into 2 categories. The first one is the failure of fertilization and early embryonic death. We will discuss in detail in the coming slides. It is a multifactorial condition, the infertility. It involves from the basic genetics, the genetic makeup of the animal. There are certain animals they used to have the greater reproductive efficiency and produce even 13-14 calves at their lifetime. And there are animals we used to face with the 2-3 conception, 2-3 calves. We used to struggle and they used to develop some problems. The genetic makeup could be also one of the reason for this infertility problem, the repeat breeding syndrome. Management, nutrition, production, these are the conditions where we have the old and we can manage to some extent by advices on the treatment. The basic causes failure of fertilization and early embryonic death could be of any of these origin: genetic, artificial insemination. The semen quality also should be ensured, and we have to practice testing the semen periodically when we go for inseminations, at least in a fortnightly basis or monthly basis, to check the quality of the semen and to maintain the fertility and to overcome the repeat breeding syndrome. Insemination techniques, we have to adopt small things like thawing of the semen and the protocols and all. We often hand over the things to our sub-staffs and illiterate people. They may not be knowing the importance of the infertility problem and the financial loss, economic loss to the dairy industry or the farmer, but to the individual. So, easter deduction, we have to ensure the proper easters in the cows. The most proper appropriate science of the easters in case of easter deduction in case of cattle is those cattle which have the stingy mucus discharge from the vulva without breaking to the ground for a few seconds. That should be observed for inseminations, and once the science of easters is observed, we follow the AM/PM rule. If the animal were observed to be in the estrus in the morning, we go for insemination in the evening. And if the animal is in the observed coming to estrus in the evenings, and it should be inseminated in the next day morning. This practice we generally do. However, we lack the evening insemination due to our some constraints. Environmental causes such as high temperature, high humidity, housing, nutrition, uterine infections, ovarian functions, delayed ovulation, anovulation, insufficiency of the progesterone from the corpus luteum, the corpus luteum of the pregnancy. All these leads to these conditions, the two major causes of the repeat breeding syndrome, failure of fertilization and early embryonic death, leading to the repeat breeders in the cattle. If you account for the incidence, it varies a great, according to the reports by the authors. Roughly it accounts for the failure of fertilization, accounts for 15% of the reproductive failure in the case of dairy cattle. It may vary even as high as 28 to 44%. Failure of fertilization. The foremost one is the ovulation aberrations. Okay, ovulation aberrations, right? There are two types, delayed ovulation. The ovulation has to take place at the end of the estrus in case of cattle, 10 to 12 hours after the end of the estrus in the cattle. If it doesn't take place, then the aging of there is a incoordination between the inappropriation between the aging of the male gamete and the female gamete, resulting in the embryonic development of poor quality, resulting in early embryonic deaths. So delayed ovulation should be checked by our veterinarians. We have to first rely on the history of the owner, whether the animal presented for the infertility problem, whether it is coming to estrus with a period of 1 day or more than 1 day. If the animal is with the And with the advent of this frozen semen technology and adaptation for the last 2 to 3 decades, with the crossbreeding policy, the crossbreed animals, they used to have one peculiar problem called prolonged estrus. There are papers, the animals used to, even in field condition, we used to hear from the owners that the animal used to be in estrus for 2 days, 3 days. This is not the normal. Usually, the normal estrus period lasts for 18 to 24 hours, maximum of 1.5 days. That too in the case of buffaloes. They used to have over 12 hours extra estrus period. Whereas the animals has to last, they has to, there should be a cessation of the estrus in the next or next day. If the animal is in estrus for more than 1 or 2 days, then the animal should be first checked for the delayed ovulation problem. Nowadays in the colleges, we used to adopt the ultrasound. Previously, we veterinarians, we used to rely on the hand, rectal examination. Rectal examination itself is one of the very fruitful method. However, now we have come with the reproductive ultrasounding. We used to go for regular ultrasound examination, especially in the case of repeat breeder animals, in the wards, and used to see the prominent follicle, the Graphian follicle present in the either one of the ovary during the estrus. Okay, that used to be visualized as a anechoic area above 1 centimeters, and it used to disappear on the subsequent days, next day. It has to disappear. That disappearance of the anechoic area, the follicles on the subsequent days denotes that the ovulation has taken place properly. If it persists for 2 days, 3 days, then we have to think of delayed ovulation, and we have to go for some luteotropic hormones like luteinizing hormone, the corulon, a dose of corulon, or otherwise gonadotropin releasing hormone, GnRH analogs like brucellin acetate, a dose along with the inseminations of the subsequent day to check the ovulation. And we have to rule out the anovulation. Anovulation is another condition. Even with the maybe with our treatment, it will be ovulating. Otherwise, there may be partial ovulation also. On 9th to 11th day, the mid-estrus, we have to check for the same area and the same ovary. It should be noted down, and whether the corpus luteum is existing in the proper place. And the size of the corpus luteum should also be noted down for its progesterone production. Ovum defects, they leads to maybe a congenital defects of the ovum, or aging of the ovum also may lead to the fertilization failure, or fertilization inability of the sperm to fertilize the ovum. The poor quality of the semen, or poor handling of the semen during the thawing, and these and all accounts for the our infertility problem in the field condition. This is one of the congenital defect wherein we could not able to see the left uterine horn, congenital anomaly, dysplasia of the left uterine horn in a cow. Acquired defect, like one, the most common one is the ovaro-bursal adhesions. The ovulation has to take place, and the fimbriated end of the fallopian tubes of the side ipsilateral ovary should be of active, and it should massage the ovary at the time of ovulation to pick up the ovum and transport the ovum to the site of fertilization, the ampullary isthmus junction, wherein the ovum meets within 10-15 minutes after the ovulation. And the fertilized capacitated spermatozoa should be waiting in hundreds to thousands at the site of fertilization, the ampullary isthmus junction, for the ovum to make the fertilization. Here in this defect, due to the iatrogenic defects, improper handling of the animal during the dystochias, even during the reproductive tract, the retained placental membrane, and over manipulation of the ovary during the manipulations. Some techniques like old people, they used to adopt a enucleation technique. They used to remove the corpus luteum and bring the animal into estrus. These and all may lead to these overo-bursal adhesions, usually in the old animals, old purchased animals brought for checkup to the veterinarians, often used to have this condition, the overo-bursal adhesion. The movement of the either side of the uterus and as well as the ovaries will be restricted. In such a case, the normal movement of the fallopian tube, the oviducts won't be there. And if the normal movement of the fallopian tube, especially the caudal-most end of the oviduct, the infundibulum, if it is impaired, then it results in the ovum pickup. It checks the ovum pickup, it avoids the misappropriation in the ovum pickup. Intra-abdominal ovulations will take place, resulting in the infertility condition. Such animals should be carefully examined and ruled out and removed from the breeding. Hydrosalpinx, the reproductive tract, in the reproductive tract, the only area we could not, the tract which we cannot able to palpate during the normal examination is the oviduct or the fallopian tubes, where the first both the gametes meets and the fertilization takes place. If there is any affections of the fallopian tubes, which is tested by the phenol sulfopterin dye test, such a conditions often results in the infertility, the reproducing syndrome. So conditions like as accumulation of fluid-like things in the fallopian tubes, hydrosalpinx, pyosalpinx, pus accumulation, and salpingitis, even burst adhesions in the oviducts. In one thing we used to, in old practice, one good old practice is administration of the lugolzidine at a lower concentration, star colored lugolzidine, 0.5 to 1% lugolzidine we used to use in the field condition. We used to get a good consumption rates. Even my doctorate guide is the only person among some 10 people in that department. They used to practice just like our veterinarians. He will go to all cases and he will send me occasionally also to cases for follow-up for infertility problem and even dystochias and other things. He used to use a lugolzidine prepared with him, lab preparation. We used to mix the 2-part, 3-part and 5 parts. Old person, Dr. Mohammed Rizwan Ansari, retired, but he is a very good practitioner, more than a veterinarian he is. He used to practice gynecology, obstetrics, just like our veterinarians. On all the areas he used to go, and by a scooter he will go and he will practice. Nominal fees he will take and follow up also. Some higher people used to have, the IAS people like that used to have maintained. That person I used to astonish the science, the literatures from US or UK, whatever it may be. They check that we should not use the irritant solutions, but he used to use it. Until I was there, he used to use the low voltage. If the stock expires, the stock solution depletes, then he will ask me to prepare 2 parts, 3 parts, and 40 parts of the water, and then the stock solution 5%. That will make the 5% of iodine. Then he will dilute it into 0.5% solution. Otherwise, he will keep it in the straw and a straw and see that whether it comes to a thin straw color. If it is there, he used to give 10 ml, 15 ml. With that, he used to check, he used to tell that lot of infertility problem he used to overcome with that things. But nowadays, if you are using such irritant solutions in the uterus, we should be careful with these conditions, because a irritant solution, even during the estrus or otherwise during the coughing also, if you are introducing in the uterus, then it may result into the adhesions in the oviducts. The adhesions in the oviducts will result in permanent fertility, infertility, permanent sterility in the case of bovine. The follicular cystic condition, I could not read here. Right, follicular cystic conditions, hydrosalpinx, in problems with the oviducts and fallopian tubes results in early embryonic death. The next major cause is the early embryonic death. It accounts for 25% of the reproductive wastage in the cattle. The major as per the literature to date, the major reproductive, embryonic death, it takes during the normal length of the Easter cycle. That is between 8th day, 8th to 13th day, for the 8th to 16th day of the Easter cycle. We all know the Easter cycle lasts for 21 days with a major portion lying with the luteal phase. Okay. During the early embryonic death accounts for 20 to 44 percentage during this period, and the embryonic death, if it takes place during the period, the animal will be repeating to the estrus within the normal length of 18 to 25 days. It may not be the owner or as a veterinarian, when we approach with the history, the animal used to show the normal length of the Easter cycle. However, it may be encountering the early embryonic death. If before the maternal recognition of pregnancy, when the conceptus secretes the food protein interferon tau from its to maternal signal the dam to check the release of the prostaglandin F2 alpha from the ovaries to lyse the corpus luteum. Before, if it takes place, before the maternal recognition of pregnancy, if the early embryonic deaths take place, which accounts for the major portion of the early embryonic deaths, accounts as per the literature to date, for 20 to 40 percentage, this death takes place during this normal length, will not be noticed with the clinical signs and our examinations. Okay. And beyond, if it takes place beyond the length of the estrus, the prolonged Easter cycles will be there of more than a length of the Easter cycle. If it is doubling, it may be the reasons could be the missed estrus or the poor estrus or the problems with the estrus detection measures we adopt. Okay. The early embryonic death may be due to infectious causes. One of the major infectious causes is the endometritis, the subclinical form of endometritis, which may not be noticed by our routine clinical examinations other than the certain measures, and accounts for the early embryonic death. The uterine environment won't be appreciable, perceptible for the development of the ovum. Non-infectious contributes around 40% of the early embryonic death, which may be the cytological, genetic factors or uterine embryonic asynchrony, the days of alignment between the developmental stage of the embryo and the uterus, premature increase in the uterine PGF2 alpha secretions, deficiency of the luteinizing, the luteal hormone, the progesterone from the corpus luteum virum, reactive oxygen species produced due to the stress and other environmental factors. Genetics factors, uterine environment, the nutrition also plays a vital role in secretion of the uterine milk, which supports the early developments, the few days of the development of the conceptus in the uterus until the nidation takes place and the attachment between the dam and fetus takes place. The age of the dam, aging results in early embryonic death in case of cattle. Ambient temperatures, higher ambient temperatures in the crossbred animals, hormonal imbalances, infectious causes. These causes could be ruled out with examinations like rectal examination, vaginal speculum examination for the discharges, white site test, endometrial biopsy, and cytological examination of the uterine secretions. The age of the dam may be influencing the infertility by lower hormonal levels, poor oocyte viability, and fertility over the age. One of the test that could be used is the butyrohydric butyric acid estimation in the field to check the positive energy balance in the case of cattle, which could be a nutritional cause, which could overcome the nutritional cause. The ready-made kits and the instrument is available, and that could be employed to check the these levels to rule out to certain extent the positive energy balance in the case of cattle. The discharge of the cows should be ruled out always, and based on the color and turbidity of the uterus due to the presence of the pus cells, we classify into scores 0 to 3. The subclinical form of endometriosis, wherein we observe the apparently clear estrous mucus, and but it will have, the discharge will have effect on the conception, and this could be overcome by a simple test, field test called white side test, wherein we mix the equal quantity of this with 0.5% sodium hydroxide and boil it mildly, will turn the color of the mucus into yellow to dark yellow color, varying degrees based on the availability of the neutrophils or the pus cells in the discharge, to rule out the white side test. This is the Albuch's biopsy catheter, which can be used to diagnose confirmatively the uterine environment by taking a small pinch of the uterus in the sides lateral to the tip of the Albuch's biopsy catheter. To take the pinch, we can subject it for the hematological histopathological examinations, and to rule out the influx of the neutrophils and the degenerative changes that takes place in the that took place in the case of the uterine environment, to check the whether the animal is fit for fertility or fit for breeding. The case of subclinical endometriosis, we can check it with antibiotics, maybe a parental, or preferably, since the endometriosis is the mild inflammation of the uterine endometrium without affecting the system. So we can select a varying range of the uterine antibiotics and antiseptics like povidone, leucocidine, whatever it may be, based on our practice, and mid-luteal induction of the prostaglandin F2 alpha, either natural PGF2 alpha and a synthetic PGF2 alpha. The natural one, dinoprostromethamine, at the dose rate of 25 milligram, 5 ml intramuscularly, we give to lutealize the corpus luteum in case of bovine. And in case of synthetic PGF2 alpha, the croplostanol, which is available abundant in the market by many companies, we give 500 micrograms intramuscularly to luteal, for lutealisis of the corpus luteum. Mid-luteal induction will bring the animal again and again into the estrus, the phase in which the estrus is a natural immune defense that will eliminate all the pathogens from the uterus and bring the animal to a fertile zone by quick means. The immunomodulators, a new school of thought by the researchers, they advise the immunomodulators to enhance the uterine defense mechanism, which will increase the uterine defense cells to the uterus both by passive and active immunity. And the common ones, many researchers have been carried out in India based in LPS of E. coli, lipopolysaccharide of E. coli, only one administration, 100 micrograms intrauterine in a PBS, phosphate buffer saline, maybe 15 to 20 ml, 30 ml, we can mix it and give. And previously we used to get this for research purpose from Sigma Aldrich. Nowadays other companies also marketing this. Autologous plasma, many researchers recently also one M.V.Sc student has done on serum, autologous serum in Madras Veterinary College. A simple thing, these photos, the conformation of the vulva also, it determines the fertility of the bovine. If you see the vulva, if it is, whether it is horizontally placed or vertically placed or a slanting is there. If the vulva is placed horizontally, what it will result? It will result in falling of the dirt and debris and other things frequently, and there will be irritation, a mild form of vaginitis will be there. There is every possibility when the animal is in estrus or coming into estrus, proestrus, the phases wherein the doorway of the reproductive tract, the cervix is opened, and beyond the mechanisms of the female, it used to pick up the infection, resulting in mild forms of infertility and the mild forms of infection, uterine infections, and then the infertility. So such an animal should be taken care and with extra cautions to avoid the vaginitis. This could be a cause for the in repeat breeding syndrome. Treatment. If you come into the treatment, the animal should be brought into the positive energy balance. A simple test what we have discussed, butyrate butyric acid to rule out the ketone bodies at the field level also can be adopted with a strip test whether the animal is in positive energy balance or negative. And we have to check the, we have to advise first for the, the treatment regime with a infertility with all the animals should be start with the hormones of the vitamins and hormones that are associated with the reproduction. We have to supplement it. Vitamin A injections and phosphorus injections, they are very essential for the consumption in case of bovine. So it should be given on alternative days for 2 to 3 times, and then subsequently it should be the animal should be supplemented with any form of micro and macro minerals, especially the coffee give copper, cobalt, copper, cobalt, zinc, magnesium, iodine. These are the essential minerals that should always be taken into care of before going for any individual treatment or specific treatment for treating the infertility. So supplementation of the mineral, even our university, they used to produce the area specific mineral mixture based on the availability of the deficiency of the availability of the minerals in the soil, fodder and the animal. They have checked and mapped throughout the Tamil Nadu, and they have developed the area specific mineral mixtures of TANUAS and marketing from the veterinary university training and research centers of the respective districts. Check the semen quality. The semen quality, one thing we used to neglect. 50% of the fertility depends on the male, okay, in nature. So we completely should not avoid. We have to check periodically the quality of the semen what we are using. So it may accounts, and we may be treating it the female for all problems. Okay. So the semen quality, at least if you are using, we are using nowadays frozen semen. So periodically we have to test the 1 or 2 straws for just a field test for at least for progressive motility. What is the percentage, whether the progressive motility is maintained till the insemination. Timing of one of the very major cause. We have to advise the signs of estrus, estrus detection measures. The most prominent, one of the prominent estrus sign is the stringy mucus discharge, and allowing the other animals to mount. These are the 2 classical signs of estrus in the best time of insemination. Spin bark test, which tests the elasticity of the mucus. Repeat breeding, repeated AA. One of the simple measure to simple treatment to repeat breeding is repeated AA. Again, doing AA will overcome the many of the problems if we are in not a position to rule out the specific cause. The length of estrus shorter in case of the indigenous animal, longer in the case of the exotic animals. Prolonged estrus is nowadays reported in our crossbred animals with mixed germ plasm with the Jersey and Frisian. The specific treatment for unestrus, for the anovulation and anovulation and delayed ovulation, we treat it with the luteotropic dose of the luteinizing hormone, corulon injection, 1500 international unit intramuscularly at the time of or along with the AA. Okay. And it can be ruled out, checked, diagnosed by the ultrasound at present available in the at least clinician centers and college levels. And the progesterone insufficiency can be overcome by a dose of luteotropic hormone, luteinizing hormone at 5 days onwards at weekly intervals in the repeat breeder animals to strengthen the corpus luteum, the formation of the small and large luteal cells in the corpus luteum virum, the pregnancy corpus luteum, and it can be alternated by the brucellin acetate, the synthetic analog of the GnRH with a 20 microgram dose, 2.5 to 5 milligram, 5 microgram, 10 to 20 micrograms or 2.5 to 5 ml of the available preparations. We can skip the A in such animals, repeat breeder animals. We can go for mid-luteal induction of the cows to bring the animals, infertile animals, again and again to the estrus and fix the time of insemination. That will alleviate most of the many causes of the reproducing. We can give a dose of PGF alpha, either natural or synthetic, between 9 to 12 days by checking the availability of the corpus luteum in either one of the ovary, and then we go for inseminations 72 hours, 30, 96 hours. I have done in many animals, infertile animals, during very early phases of my practice, and I used to get calves with this simple technique. Maybe a single dose of PGF alpha that nowadays are available in many veterinarians easily, many VDs. CIDR, ear implants, PRID, these are the progestational devices which block the progesterone and releases the superior level of spurts of release of the GnRHA, the gonadotrophic hormones, both at the level of the anterior pituitary and hypothalamus, and overcome these defects. PG, already I have discussed. PG program, there are 3 techniques. One injection program. First, examine the animal. Those animals having the corpus luteum, we go for a single dose of prostaglandin alpha, either synthetic or natural, and go for insemination 3rd day and 4th day, 72 hours, 40 days, 96 hours with a double straw. It used to alleviate many a times the infertility problem. 1.5 injection method, where we could not able to first examine the CL. Those animals having the CL, we go for a PGF2 alpha injection, and then we treat the we go for AA, and then next if those animals, those are first give injection blindly, and those animals coming to estrus, we go for insemination, and if it is not coming to estrus, we go for next dose after 9 to 12 days. The responsive phase, among the 21 days of the estrus cycle, the responsive phase lasts during the 8th, 9th day to 16th day, where the cow harbors the mature corpus luteum, the cyclical corpus luteum spurium in the either one of the ovary for the progesterone, for the prostaglandin alpha treatment. These are the preparations and the dose of the synthetic and natural analogs of the prostaglandin alpha, cloprostenol, dinoprostromethimine. This is one of the device we often use in our research animals in the field condition to overcome the infertility problem. CIDR, controlled internal drug release, easy breed, costs around 800 rupees, 700 rupees, available abundant Chennai and many places we can get this. This will overcome many of the hormonal problems and other causes, and that will fix the time of insemination in the case of cattle by alleviating many causes of the infertility or the repeat breeding in case of cattle. This can be very well adopted in the field to synchronize the animal and bring the animal into the estrus at a fixed time, and do the artificial insemination with the fertile semen to achieve the maximum fertility. The OV sync protocols, there are so many sync protocols are there. They use the gonadotrophin hormone, prostaglandin alpha hormone alternatively on different dates to fix the time of insemination, to fix the time of estrus in a infertile animal, or even a group of animal in a herd, to synchronize and bring the animal into estrus and breed and get the maximum fertility. The basics, the cattle, if you see, at the time of birth, the female cattle, they used to, even in the fetal life, they used to harbor lakhs of 1 to 1.5 lakhs of the primordial follicle in both the ovaries. That used to deplete during the reproductive life. During the estrus cycle of 21 days, there used to be a 2 ways or 3 ways. Cohorts of follicle, a group of follicles get selected from the primordial pool. They used to develop into primary follicles, secondary follicles, and tertiary follicle, the antral follicle, the gonadotrophin dependent follicle. Then it used to develop into the Graphian follicle, the mature follicle that used to come into the surface of the ovary and burst, ovulate, and then goes for the fertilization. If it is a two-way cycles in the particular animal, the animal will be having the first follicular wave, wherein the group of follicles selected and grown to the tertiary level, they go for atresia, the self-death, the apoptosis, the physiological death. It used to take place, and they used to come to, our goal should be either targeting the first wave or second wave to bring the animal to ovulation and fix the time of insemination and conception. The three-wave theory, wherein the length of the estrus cycle may not be varying great, maybe 1 or 2 days extra, and the follicular waves will be of shorter duration, 7 to 9 days duration. Ethno-veterinary practice also nowadays coming up with the in practice. We can think of those farmers, poor farmers, and very poor farmers, those who we can help, and where these things are abundantly available in village conditions. This treatment, one protocol, there are many protocols, even our YouTube will tell so many protocols. This we used to practice, we used to give certain level treatment protocol with 4 days of 1 to 2 leaves of the aloe vera for first 4 days, then muringai leaves, 4 handfuls for 4 days, the consecutive 4 days, then the parandai, cut chopped ones, 4 handful, roughly 4 handful per cattle for next consecutive 4 days, followed by the curry leaves. Curry leaves we can get in the village condition. We can advise the owner instead of going for treatment, then bring the animal for estrus to these varying research. There are so many researchers elucidating the beneficial effects of these things. Even this curry leaves, there's so many articles, so many international papers are from IVRI, and they used to work on their effect on the estrogen, luteinizing hormone. They used to modulate the hormonal levels of the bovine in the case of. So such treatments can be adopted wherever we could not able to extract money or other things. Just advise to benefit of the owners, we can adopt. Conclusion. In conclusion, the repeat breeding syndrome, one of the major culprit, the puzzling task in front of the veterinarians could be overcome by the basic approach of and bringing the animals into the positive energy balance, and checking the uterine infections, identifying and treatment the conditions such as subclinical endometritis, proper timing of the estrus, and ensuring the quality of the semen at the time of inseminations will overcome these the puzzle repeat breeding syndrome. Thank you. Thank you one and all for the opportunity. Questions? Sir, simple gentamicin, it used to give good results. Sir. Very cheap, very easily available. 2 ml of gentamicin mixed. I used to get 1 hour after AA also used to give, or even to check we can go for the best ones as per literature, as per very not nowadays the treatment, the literature that articles are not coming. But 2 decades back, the chlorophenicol, one professor from Orissa, he did PhD extensively on these uterine infections during the infertility problem. He has reported a chlorophenicol, the soluble form, water soluble form, biophenyl succinate, 1 gram vials are there. He advised that one with 100% of consumption rate. We don't know that. But the thing is, it can be simple gentamicin, what we have in our ward. All wards we have gentamicin. The dilution should not exceed 10 to 15 ml to the uterus, sir. Anything. Because the higher volumes to the uterus may create problem with the oviducts. So, we have to limit ourselves with the uterine horns. That's advisable one is 15 ml, 10 to 15 ml, 20 ml, maximum 40 ml. But the, sir, 2 ml, sir, 2 ml plus 13 ml. Yes, sir. Yes, sir.
How to identify first, second, third, and which wave is better to breed than?
The third wave only, sir.
How,
Otherwise,
how to identify first, second, third?
no, we cannot identify, sir. And these are all theories, and we have to, if otherwise we have to go for ultrasound examinations. When, if you keep on daily examining the ovary, both the ovaries, you will be observing the anechoic areas developing. If you study the entire length, we can study the follicular waves in the field condition, and we can check it.
Autologous plasma.
Yes, sir.
How to do that, sir? What is the approach in subclinical endometritis or any severe postmortem endometritis and all?
Sir, autologous plasma used to give the passive immunity to the uterine environment. It used to supplement the immunoglobulins, immunoglobulin G and A, rich in our blood. We have to collect the blood, and the blood bags are there, sir, I have seen, and we have to collect the blood and centrifuge it in the minus 20 degrees centigrade and preserve it, and immediately we have to transfer, or otherwise the subsequent days, if you are giving, on subsequent days we have to go for storing of the autologous plasma for at minus 20 degrees centigrade. We can, there are reports, continuous treatment of first, second, third day, consecutive days, and consumption rate improvement in the cattle.
In first, one cycle which has suspect for treatment we have to do, sir.
Yes, sir.
Intrauterine, how much ml, sir?
50 ml we used to give, sir.
50
One
ml.
article it says 50 ml.